Okay, we're going to go ahead and get started. Just want to say good morning. Thank you everyone for joining us today. This is Tri-City's been hosting a webinar series since April, and thank you for joining us today. Our topic will be on minority mental health, and myself, Lisa Naranjo, will be co-facilitating this webinar with Jennifer Fang and Hannah Sprague. All three of us will be presenting to you minority mental health topics, research information within the next hour. If you cannot hear me, please let us know by using the Q&A box if audio is a challenge. So as I said, for those of you who may or may not know, we are doing the topic today, minority mental health, because July is Minority Mental Health Month, and we thought it'd be an appropriate topic to discuss today and share with you some of the barriers and challenges that minority communities face with regard to mental health challenges specifically. So just some quick housekeeping tips. If you've been on our webinars before, this is familiar with you. And if you're new to this webinar, this is the first time you're joining us, welcome. Thank you for taking the time on your busy day to join us. All participants will be on mute and your cameras will be off during the webinar. We will be recording this webinar and it will be posted on Tri-City's webpage within the next 24 to 48 hours. And we'll let you know at the end of the presentation where to find this webinar recording. If you do have questions, comments, we please welcome you to use the Q&A box, which you can find on the bottom or top of your screen. It's a little Q&A box. You can go in there and you can type in your questions. Myself, Jennifer, and Hannah will be rotating and answering those questions directly, or as the presentation moves on, we'll answer them to the whole group. If there is a private question that you want to ask but don't want everyone to see, please, on the drop-down option menu, click on Jennifer Fang, and she'll be directing all private questions and responding to you directly and not to the whole group. For immediate support, if you find yourself that you're in a crisis and need immediate support, we ask that you call Tri-City's 800 toll-free number at 866-623-9500. At that time, you can be directed with our receptionist and you can share with them the support that you're looking for, the services you're needing for yourself, a loved one, a family member, or someone in your community. And as always, if it is an urgent matter and it's a crisis that needs immediate response and attention, always please call 911 for that. And lastly, if you, when you logged in, a second screen should have popped up on the back end, and that is a SurveyMonkey for you to complete a survey at the end of this webinar. We highly encourage you to take a moment to answer that, complete that SurveyMonkey and answer as honestly as you can. It gives us really good feedback on how our presentations are going, and it also gives you an opportunity to share ideas on topics that you would like for us to host in the near future. Agenda that we hope we'll be covering today within the hour is looking at Bibi Campbell-Moore. She's a pioneer who really spearheaded the task force to bring minority mental health to the forefront. We will look at mental health by the numbers. We will be looking at statistics across the US for adults. And then we will dive in and break up that into the minority communities we have identified for today's presentation, and what do those communities, what disparities communities come across with regard to mental health services. And then lastly, we will be identifying a lot of great local, national resources, online supports, apps that are available, and how you could utilize them or share them with friends and family colleagues who could benefit from those resources. And then when we wrap up, we'll just finish with some Q&A questions if we have not addressed them during the presentation. All right, so the very first slide that we have here, this is Bibi Moore Campbell. This is a picture of her that we found that really we liked, and she seems very calm and at peace, and this is actually one of her bio portfolio pictures that we found. So for those of you who may not have heard of Bibi Moore Campbell, she was a best-selling author, journalist, and teacher. And before she really started her her fight or her efforts to bring minority mental health to awareness, she had those roles and really was an author and wrote some really great books, which we will show in a minute. But the one that she released in 2003 was her first children's book called Sometimes My Mommy Gets Angry. And it highlights a young girl's journey of living with her mentally ill mother. And that was the first children's book that she did that really tackled mental health from a children's perspective, and then really just kind of started her work with wanting to bring more awareness to mental health within minority communities. In 2005, Campbell started the National Minority Mental Health Task Force to fight the stigma minorities have around mental health. And she did a lot of great work in 2005, and also at that time became a founding member of NAMI Inglewood, which today is called NAMI Urban Los Angeles. And so she did a lot of great work, and unfortunately 2006 she passed due to cancer. And in 2008 is when the U.S. House of Representatives designated July as Bibi Moore Campbell National Minority Mental Health Awareness Month. And so just wanted to pay homage to the woman who really fought and advocated for awareness for all minority mental health communities, but African American communities especially. The next slide here, we have just a few of covers of the books that she's authored and wrote during her span of her career. These we picked because they have to do with mental health, trauma, and the impact it has on African American communities from her perspective and her experience and research that she's done. So there's a lot of other great books that she's written, but these are the ones we wanted to highlight and encourage you, if you want to know more about her, to potentially pick up one of her books and read. They're really great novels that she's written. The one in the middle is the one that really started her work for minority mental health awareness. And then last, this is just a few quotes that Bibi Moore Campbell has shared, and we thought was really good to share in her words, her thoughts about minority mental health. And I'll just pick one and read, and it says, "Stigma is one of the main reasons why people with mental health problems don't seek treatment or take their medication. People of color, particularly African Americans, feel the stigma more keenly. In a race-conscious society, some don't want to be perceived as having yet another deficit." And so I thought that was very fitting and appropriate for Minority Mental Health Month when we look at what are some of the deficits, what are some of the challenges and barriers, which we will get to during this presentation. Okay, so this first slide, we try to go light on statistics. I know we can go really heavy with numbers and data and statistics, which is important, and I wanted to highlight some of those. But really the goal for this presentation is to get to the barriers, risk factors, protective factors, and how to really support minority communities. But just wanted to lay some foundation as looking at the numbers from as a whole. And this slide really just looks at mental health in the US. So these statistics are across the United States, across all genders and ethnicities, and looking at adults specifically. We did not look at youth, but we focused on adults for today's presentations. And as you can see, 18% of US adults have a diagnosable mental disorder in a given year. Mental health mental and behavioral disorders are among the leading cause of disability in the US. And that is true even for more common physical health conditions like cancer and diabetes. Mental and behavioral disorders are the leading cause of disability in the US. There are more disability claims due to mental health challenges than physical health. And lastly, 43% of people with any 40% of people with any mental illness receive treatment. Actually, I think they do not receive treatment, so I apologize for that. And we'll talk more about those percentages as we move forward. This is just a breakdown, again, where this chart is looking at adults across all race and ethnicity and gender across the US in a year span. Looking at specific disorders and what the numbers show. So depression right now, if we had to do percentages, it's 7.1%, just over 17 million adults. Anxiety, that's 31.6%, just over 42 million. And substance use disorders, 19 million, which account for 8%. And last, suicidal thoughts is 9.8 million adults have an impact. So again, these are percentage of adults impacted by these disorders. Overall, this accounts for 44 million, which is 18% of the adult population who have a diagnosable illness. And so just piggyback the fact that only 43% of adults seek treatment. That's less than half individuals who get help for mental health challenges that are treatable, can be prevented, and there can be addressed if help is provided sooner than later. And so this is where we want to focus too, is across the US, that's a huge disparity, but the numbers really have a bigger impact when we look at minority populations. So before I move on to minority mental health specifically, just want to check in and see if there's any questions that are coming in on the Q&A tab that we can address at this time.
There are no questions at this time.
All right, thank you so much. So now just shifting over to minority mental health specifically, I just want to identify the communities that we are addressing in today's presentation. The minority communities would be Black, African American, Latinx, Hispanic, Asian American, Pacific Islander, Native American and Indigenous, and the LGBTQ community. When we talk about minority communities, these are the 5 that we will be emphasizing on today. So we're going to take a look, kind of like we did across the US adults, we're going to look at minority mental health by the numbers and what do the numbers show. As a side note, all of this information we gather looking at SAMHSA, Minority Mental Health America, and NAMI. So again, the resources will be provided at the end, but if you're curious as to where these images and data came from, those are the sources that we've looked at for today's presentation. This slide right here, Minority Mental Health America put together and really just wanted to show across the US what BIPOC and LGBT numbers look like with regard to mental health. And just again, BIPOC, it's a fairly newer term that a lot of agencies and organizations are adopting to identify minorities, which stands for Black, Indigenous, and people of color. So if you've heard of that, fantastic. If not, I just wanted to explain what that was. But according to their research, 41.8% of the US population are people of color, and 13.5% were born in a different country. And lastly, 4.5% of the United States population identifies as LGBTQ. So that's the larger numbers, again, across the US. What our next slide looks at is prevalence of mental health conditions in specific adult populations. So the percentages and numbers here, pretty much looking at the 5 minority communities we identified, we really want to look at, in general, what do mental health conditions look like within these specific populations? What is the impact? What are the numbers? And again, this is based off of what individuals have reported, shared, potentially have received services, seek support, and accessed care when appropriate. So for each of the communities, we have their percent and then also the actual number. So for the Latinx Hispanic community, 15% make up about 8.9 million who have a prevalence of a mental health condition. Black African American, 17% with 6.8 million. LGBTQ is 37%, 3.9. Asian American Pacific Islander is 13%, with 2.2 million. And finally, Native American, Alaska Native is 23% at 830,000. So within those specific communities, these are the prevalence percentages regarding mental health conditions. So one thing that we really wanted to focus on is within these minority communities, what are some of the attitudes, beliefs they may have towards mental health? Across the board, mental health has always been a challenge for folks to seek services and get treatment. But within minority communities, were there any attitudes or recurring themes that were showing up as potential barriers to support and services? And what we found that across all 5 communities, these were some of the attitudes that kept on coming up as to why minority communities don't like to talk about mental health, why they don't acknowledge mental health, and more importantly, why they may refuse or not want to seek treatment, support, services for their mental health conditions. So the biggest one is stigma. There is quite a bit of stigma about mental health, and we'll talk about that more in length. And that's probably true across all ethnicities, but minorities for sure don't want to have another layer of stigma associated with them, and another challenge that they may have. Fear of being discriminated against. There's also a lot of shame and embarrassment that comes from acknowledging that they, quote unquote, may be mentally weak in the eyes of that community. I know for a lot of folks, saying that I feel sad is a sign of weakness. You're not strong. You're not worthy. And so that kind of puts people hesitant to share what they're feeling with regard to mental health. And lastly, spirituality. For a lot of minority communities, spirituality and their faith plays a huge part in their daily lives and their community that they identify with. And so it kind of goes either way. A lot of folks feel that your faith is what will heal you. Your belief is what will save you from having these thoughts, these negative thoughts or feelings that you're experiencing. And then on the other side, it's maybe you have lack of faith in yourself. That's why you're experiencing these symptoms. And so those were just some of the attitudes and research that we were reading that came up that folks have with regard to the mental health. And we'll actually have an opportunity for you to share what your thoughts are. But these were just a few of the attitudes that were reoccurring throughout our research. So we're going to take our very first polling question and just get your thoughts on what might be some barriers that you know of, that you maybe you yourself have identified as a barrier. So I'm going to quickly pull up the polling question, and please let me know if you cannot see it. This is a question. It's a multiple choice. You can choose more than one. But the question is, what protective factors do you think support? Actually, I'm choosing the wrong one. So sorry, jumped ahead. I'm going to end this one. I'm going to the first one. Barriers. Sorry, got a preview for the next one. So what do you think are the most challenging barriers when seeking support services for mental health disorders? So you have the opportunity to pick more than one, or one that you feel is the most challenging? Thank you for folks who are chiming in. And again, these could be barriers that you know of or you yourself have had when trying to seek support. And I'm just going to go ahead and give it a few more seconds. For those of you who completed the survey, thank you. And then I'll share the results with all of you as well. Okay, so we're going to stop right here. I think that pretty much shows everyone what we'd have. So right off the bat, everyone agrees that the biggest barrier that prevents individuals from seeking support is stigma. 91% of you agree with that. The second one was lack of culturally competent professionals. That's 55%. And I'm glad that we touched on that, because we will talk about that further in our presentation. Next was lack of knowledge of mental health, lack of knowledge of resources, lack of knowledge of professional services. So that right there was 45. Insurance and language came in at a tie of 36%, feel that could be a barrier. And last, transportation, access to services, where geographically is it located and how to get to it. So thank you everyone for sharing and taking a moment to complete the poll. And now I'm going to move on to the next slide. This is a video we want to share with all of you. It's a short video about less than 5 minutes, and it really talks about exactly what we've just been talking about. What are the barriers? What are the challenges that impact minority communities from seeking services? So hopefully you will be able to hear.
It's hard enough to get mental health treatment in the US, but it's even harder if you're not white. Studies show that racial and ethnic minorities are significantly less likely to receive mental health treatment than whites. So we reached out to experts to find out why it's so hard for people of color to get help. The first thing is stigma. In other words, shame or disgrace that can make people feel excluded. Stigma is a big deal in the US, but especially in communities of color.
The Asian American community has high amounts of depression, anxiety, and other mental illnesses, just like...
Oh no, sorry.
It's hard enough to get mental health treatment in the US, but it's even harder if you're not white. Studies show that racial and ethnic minorities are significantly less likely to receive mental health treatment than whites. So we reached out to experts to find out why it's so hard for people of color to get help. The first thing is stigma. In other words, shame or disgrace that can make people feel excluded. Stigma is a big deal in the US, but especially in communities of color.
The Asian American community has high amounts of depression, anxiety, and other mental illnesses, just like every other community. Even when people might get connected to a healthcare provider, often the family doesn't understand. They feel like if it's known that their child is seeking help, that the family will be looked down upon.
Your cultural value, your cultural circle does not afford you the possibility of asking for help. Not being able to even verbalize that piece then leads people to very dark corners and very dark places. Depression, untreated depression in those cases oftentimes leads to suicidal ideation or drinking or substance use of some sort.
The second reason is a lack of cultural competence. Cultural competence is a doctor's ability to recognize the different places their patients are coming from and then be able to adapt to their needs.
Traditionally, African Americans will not come in and say, I'm depressed. They'll say, I'm sick and tired of being sick and tired. Fatigue is a real clear sign. So they'll not really even appreciate themselves that what they're experiencing is a mental disorder, because that's considered frailty. And frailty is something that's not really considered acceptable in a community that consists of mostly working people.
A person might be considered psychotic if they say they believe in ghosts, but this is a cultural belief. Sometimes it can rise to the level of a delusion, but sometimes it just has to be taken into account.
Not being sensitive to culture can lead to a wrong diagnosis, and that's happened. And it's led to a legacy of distrust. That distrust has included outright racism.
During times of slavery, African Americans, particularly African American women, were experimented upon in terms of OBGYN surgeries, and there's clear history of that. They were also subjected to an experiment called the Tuskegee experiment.
We're talking about a federally funded 40-year syphilis experiment that turned people into human lab rats without their knowledge. And by the way, that experiment didn't end until 1972. And for people who don't speak English, finding a therapist who speaks your language isn't easy.
On a national scale, the lack of mental health providers that speak other languages is large. Think about the areas of conflict right now, the Middle East. There's a lot of people coming from Syria. Who speaks Arabic fluently? When you think about people migrating from Africa, people from Ethiopia or Eritrea that are coming to the United States, there's, I don't know how many languages in India, not everybody speaks Hindi.
Finally, there's a lack of providers. And few mental health care providers of color, which could go a long way into tackling all the issues we just discussed. And while the Affordable Care Act has helped a lot of people gain access to treatment, who's filling all that demand? And if people have to wait for hours in line just to get treatment, which patients will fall through the cracks? When it comes to mental health in the US, there's a lot of talk and little action.
Okay, just want to give a chance if there's any questions before I hand off to Jennifer Fang that came up during this video. Just a lot of great information. Again, resources will be available. We can share with you at the end if you want the link to this video. Any questions before I move on, Jennifer?
No questions at this time, Lisa.
All right, so I'm going to have Jennifer take over.
Great. Thank you, Lisa. So I'm going to go ahead and take over, and I'll be going over the next few slides. And so the first one is the racial and ethnic minority groups in the U.S. Something really important to know is the U.S. population continues to grow and expand. So according to the American Psychiatric Association, by the year 2044, more than half of all Americans are going to be projected to belong to a minority group. And this is why just talking about minority mental health, racial and ethnic minorities is so important, is that we will be having more individuals who will identify in a variety of communities and populations, and that it is going to be important for us to recognize that. Racial and ethnic minorities are less likely to have access to mental health services and utilize community mental health services. Racial and ethnic minorities are more likely to use the emergency department and receive lower quality of care when they're accessing mental health services. Studies have shown that racial ethnic minorities overall have similar, or in some cases, fewer mental health disorders. However, those who have been diagnosed have been seen to have more long-lasting effects when they have a mental health symptom. And poor mental health care access and quality of care contribute to poor mental health outcomes. And this includes suicide. We've talked about substance use and abuse, especially among racial and ethnic minority populations. Next. The next one is just talking about the barriers of mental health services. And something that you're going to notice is that when we talk about barriers, you're going to see that it also goes into line of risk factors and disparities. And so there can be a number of reasons that can prevent the access to care and the prevention of access to care to individuals when we look at racial and ethnic minority groups. Understanding these barriers actually helps us eliminate the mental health disparities to help those who are experiencing mental health illnesses receive the services that they need. What we just saw in the video talked about some of the barriers, and what I'm going to do is highlight a few of them and also go over the ones that they've also shared as well, because as we look at barriers, there's going to be some commonalities as well, but also what I want to bring out is that this is not a comprehensive list. There's going to be a lot of disparities, risk factors, and barriers to certain individuals, and also some communities may identify more of the barriers more than other communities and the population. And so the very first one which they talk about is the lack of insurance. And this can come in many forms. It can be due to unemployment, which also leads to financial instability, so they can't afford the services that are asked. The next one is stigma. Stigma comes in multitudes of areas, and it could be due to just what the idea of mental health is, or what would receiving the services look like. And it could be for those who might assume who's going to look at them in the community, how their family members are going to perceive them, or even how their coworkers or colleagues or others around their social system looks at them. The other one is the lack of diversity. And this comes to when they talked about in the video as well, is who's providing the services? What community are we looking at? What population are we looking at? An example that you can look at and notice is if you are working with a staff that might be filled with, maybe the clinical staff are white Caucasians, but you are providing services to the BIPOC community. And that could be kind of something to highlight of, do we have the diversity in our community to provide the services to allow those to come in and feel comfortable to share their experiences? The other one is the lack of culturally competent providers. An example of this would be, do we have providers that have knowledge of the communities that they're working with? Do they understand the experiences? Do they understand the trauma that the individuals who they're speaking with are going through? A lot of this stems from a lot of education, acknowledgement, and awareness as well. They've also shared a lot about the language barriers. As our population grows, we have a community with a number of languages that are seeking support, and we have those who might not be monolingual or bilingual who need the services but don't have that access to care for that. Another one is mistrust, and they shared a lot about it, is due to a person's circumstance or their experience, this may highlight why they may not want to receive the services or reach out for the support because of certain outcomes or certain things that have happened to them during their life journey. The next one is the lack of awareness. When we think about mental health, it's more of a Western thing, right? So when we think about it, is does the individual, does the community, does the population even recognize what mental health is? We are normally focused on the physical health conditions. So sometimes the symptoms that they are showing or perceiving, they see it more of a physical, not realizing the connection that it has to their own mental well-being. And the next one is the lack of resources, depending on where the individual is at in the community or where they are at receiving the services or outreaching or connecting with others. There might be limited resources depending on what they're specifically looking for. All right, go ahead and next. As we were just talking about the barriers, risk factors tie in with it as well. They really overlap, especially when you do a lot of research and readings. You're going to notice that when they bring up barriers, they bring up disparities, risk factors come into a play. So some of the things I might be sharing will overlap as well. And so many of the factors of why we look at risk factors is that it influences a person's chance of developing a mental health disorder, as well as the severity of the mental health disorder. So this is really important to see what is going on with the individual. And when we look at risk factors, we look at the biological, psychological, and the sociological level that is associated with the higher likelihood of someone receiving that negative outcome. And risk factors are very similar. So what we're going to go through is I'm going to share a little bit about some of the risk factors, that these are more of the patterns that we are seeing when individuals are coming in and sharing their experiences when it comes to mental health services. We look at the socioeconomic status. This is looking at, once again, a person's financial status, their income level, and this plays a really big toll because depending on where someone is with their socioeconomic status, it might depend on the community that they end up living in or the resources they're going to receive, because those who are in socioeconomic economic status that is of lower levels, the community that they provide, they would have more underserved and unserved communities that reside there. And with that is we look a lot more with the BIPOC communities. They have the limited access to care, limited funds to receive the care. And also when we think of resources, we talk about language, we talk about being able to connect with the community. There might not be a lot of individuals who can provide those services and understand what's going on in that pocket of communities. The next one is the support. This can vary depending on when we're looking at who is their support system when they're reaching out, how does the individual receive the support system when they are reaching out, and even how often do they receive the support system? Is it one time a year? Is it one time a month? Do they have the accessibility to reach out to their support system on an as needed basis? And also when they receive the support, is it before an event that is traumatic that happens? Is it after they're looking for someone? Or is it during the actual trauma or their mental health symptoms that have exacerbated? So it really is important to look at the timeframes when someone is looking at that support system. The next one is trust. I know they've highlighted it in the video. We've also highlighted it here, is that trust can be both a historical trauma and past experiences. And what it does is it impacts the level of trust to be able to open up to someone. It is already hard for someone to share an experience to someone who they know. So imagine being able and having to share it with a stranger or someone who they only met for the first time. So depending on the severity of the trauma, it can prevent someone from reaching out for the support, you know, having the thought of someone judging them, having the thought that a community member might start avoiding them or not want to be near them. All that can play into the role of a risk factor of how someone reaches out for support. And it's also really important when we think about what trauma is, when we think about risk factors, it always is different from person to person, to really take the account that each person is unique and that when they share their stories, when they share their journey, when they share what is going on, that we really look at their specific story, their specific narrative during the whole process. Next. Well, you know what I'll do at this time, actually? Do we have any questions, Lisa? Let's see.
Jennifer, at this time, we don't have any questions.
All right, thank you, Hannah. So the next one we're going to cover is just looking at racial trauma and how it impacts mental health. So when we look at racial trauma, we think about, first of all, what is trauma? I know a lot of people use it very loosely. We hear it in our everyday life. We hear it when we interact with other people. And we also hear it when we're looking at the social media. And so when we look at trauma, racial trauma refers to that mental and emotional injury that's caused by encounters with racial bias and ethnic discrimination, racism, and hate crimes. Any individual that has experienced an emotionally painful, sudden, and uncontrollable racist encounter is at risk for suffering from a race-based traumatic stress injury. And it's really important to know that in the US, when we talk about Black, Indigenous, people of color, which you've seen as identified as BIPOC, they're more vulnerable due to living under a system of white supremacy. And what we're going to do is cover, there's 3 types of traumatic stressors. And what I'll do is I'll share what each of them are and give you an example so you can see how you can also look at your everyday life of where maybe you might identify within some of these stressors. So the very first one is direct. All direct traumatic impact of living within a society of a structural racism or being on the receiving end of the individual racist attack. So this would be more of a personal, so this is directly towards you. An example would be maybe the racial profiling, a microaggression, someone assuming you are someone who you aren't or you are something that you aren't, and the physical and verbal abuse that you might be receiving yourself. The next one is the transmitted trauma, a traumatic stressor that are transferred from one generation to another This stressor can come from the historical racist resources or through trauma passed down through families and communities. So sometimes what we can see is an example would be the sustained collective trauma that is experienced by Black people from the enslavement of Africans in the US and other countries as well. And another one that we've seen as well a lot and that has been talked about with communities is shared by the Native Americans. This includes, the forcing people into like the boarding schools. A lot of Native Americans share experience and stories about the massacres and the violence that they had to see, and being able, they were forcibly removed from their own tribal land. And when you collectively ask Native Americans, this is a communal loss. So that is a very transmitted trauma as well. And the next one is the vicarious trauma. So this is the indirect trauma impact of living within the systemic racism and individual racist actions. So this is going to be things that you might be experiencing by maybe watching a lot of videos that have a lot of violence or killings. It could be towards a specific group, community, population that you're seeing. Witnessing violence in itself can be traumatic. Another one could be you might be part of a community that has a higher level rate of suicide or homicide. That can be impacting your level of trauma. And another one would be just being in a community that is severely underserved, that is unserved, that don't have the capacity to reach out. Those who are experiencing symptoms within that community can also say that their trauma has increased. And that is another example of vicarious trauma as well. All right, next slide. Oops, sorry. We will get there. Okay. So the next one that we really want to talk about as we are talking about the different types of trauma is the impact that, once again, it has on our mental health. Because when we think about racial trauma, what it does is it increases the risk of those who identify in the BIPOC community to meet the criteria for PTSD. And when we talk about PTSD, for those who may not know, it stands for post-traumatic stress disorder. And some of the symptoms that you might see in someone who identifies with PTSD would be the avoidance. They might be experiencing reoccurring thoughts. There might be a replay in their memory of the traumatic event. Some have shared depression, anger, anxiety. Some experience that physical reaction where their body is letting them know, like through pains of like headaches, their chest pains, the sweaty palms, the tension in their shoulders. And with that is that it plays such a crucial role in how racism affects both the physical and our mental health when we think about trauma and the various types of trauma and how it can influence a person's physical change as well. And so when we think about stress hormones, what ends up happening is it gets released during stressful situations, and research has shown that both the experience of and the observation of racial discrimination is so stressful that it impacts both children and adults with those who identify within the BIPOC community. These frequent presence of stress hormones, what it does, it leads to a lot of the physiological changes that impact our, we might have a lot of individuals who are in the community and they identify with saying when they go see the doctors, they visit the doctor and the doctor sharing that they might have high blood pressure, heart disease, they have a lot of medical issues due to the stress. And on top of it is the mental health symptoms and the conditions that also can occur, which is the excessive anxiety, the PTSD that we have shared about, depression. Some identify with dual diagnosis where they may have multiple mental health symptoms on top of a substance use. So all of these play in a fact of how trauma can play a role when it comes to mental health, especially in the BIPOC community. And this is why it's so important for us to continue to educate ourselves of how individuals are affected with what's going on in our communities through our interactions, through our education, and through our knowledge as well. So what I'm going to do is, I believe we have, I'm going to go to the next slide, Hannah.
Thank you, Jennifer.
And what I'll do is I'm going to hand this to Hannah. We are going to do a quick poll at this time, I believe.
Okay. So this is going to pop up really quick in your guys' windows before we actually touch upon what protective factors are. And so what do you think are protective factors that can actually help support mental health well-being? And we'll give you a couple of moments right now to answer. And there you can also choose as many of the answers that are available for you. Okay, I think we're going to end the polling right now. Thank you guys very much. So the number one protective factor was faith. 100% of you thought that that is important for supporting mental well-being. 91% believe that at least having one trusted person to connect with, that social support is so crucial, especially in times of need. 91% having access to maybe positive family, extended networks. 82% shared experience. So that is really in connection of, being able to identify with another individual that has that shared experience, your peers. 64%, again, having access to maybe support groups that are available to connect with people who have had that shared experience, same story. And 73%, the ability to have access to care. Okay. Let's go on to that next slide. So it's important to note that risk factors are not predictive factors, and this is due to protective factors. And this quote is from Dr. Carl Compton Bell, who was an American professor of psychiatry and public health at the University of Illinois at Chicago. And just as Jennifer mentioned before, mental health issues are complex and are never the result of one risk factor. So someone who has several risk factors could have more resiliency toward problems than someone who's experienced less risk factors. And this is in part due to protective factors. So what are they? In essence, protective factors give people and foster resilience in the face of adversity and can help moderate and buffer the impact of stress and risk factors on your individual social and emotional well-being. And these are just a couple that we will touch upon, and you'll see that there is some overlap with what you guys just shared as well in the poll. So having a concrete support system is especially crucial in times of need. So for example, having an immediate or extended family support, or a positive family climate and parental involvement, all of these are key factors that contribute to resilience in children who have faced childhood adversity. Having positive social support. Even right now, social support available through online social networks is associated with increased emotional support and belongingness. And this is particularly vital now during COVID, as we're looking for ways to decrease isolation and maintain our social connection. Another factor is resources, and this includes both the knowledge and availability of resources in your community. So do you have access to support groups and activities or local behavioral health services? In your community, do you have access to faith-based resources? And another protective factor, and most importantly, is the sense of connectiveness. So being connected to people in your community is such a powerful protective factor for everybody's wellness, resiliency, strength, and mental health. A sense of community also reinforces your own cultural identity and is a positive perception of belonging. And so this then ultimately helps counter these feelings of isolation and helps provide an individual a sense of security and also then can help increase self-esteem. And so that's something important to consider, is what makes up your social fabric? Is it your culture? Is it a community group that you're affiliated with? Your own faith and spirituality, your school, your family, or someone, a group of peer supports. Okay, next slide. So here are just a few ways that you can help increase public awareness about the unique struggles that BIPOC and LGBTQ communities face with regards to mental illness, and ultimately help reduce the stigma that these communities experience. So number one is you can help make a pledge. You can help encourage positive conversations about mental health by taking a pledge on our roomforeveryone.org website, which is Tri-Cities Stigma Reduction Campaign for Pomona, Laverne, and Claremont. You can do your part to change how you talk about mental health in your family, in your social and spiritual communities. If you use language that acknowledges and respects a person's condition, you can ultimately encourage them to seek treatment and decrease the stigma that they may be experiencing. Another important way that may be overlooked, and it feels so simple, is to share your story. And now more than ever, the mental health community must come together and show that no one is really ever alone. You can join, for example, Tri-Cities Courageous Mind Speakers Bureau. And that consists of individuals who have been both directly and indirectly impacted by mental illness. So you as a speaker learn how to craft your story of recovery and resiliency, and help lead this coalition of speakers to help fight stigma, inspire others, and educate the broader public about mental illness. And so what we know through sharing your story is that by providing your perspective and your lived experience and disclosing your cultural identity, you encourage others within your community who identify with your story and make them feel less alone in their mental health journey. And lastly, and kind of encompasses, is to really help spread the word and get involved. We know that lack of information and misinformation about mental illness can lead to distrust and mistrust of mental health resources and seeking care. So we encourage you to visit Room for Everyone to educate yourself and others about minority mental health. And then you can then help us spread the word through awareness, support, and advocacy activities in your own capacity. One way to do that, for example, is just to wear a lime green ribbon, which is the symbol of mental health awareness. And you can then help start positive conversations about mental health within your community. Okay, next slide. Another way, we're giving you guys tons of ways, is to make a difference by getting involved at a local level within your community. And so this really is a call to action. We invite community members and partners within the cities of Pomona, Laverne, and Claremont to join Tri-Cities, and it's a mouthful, Cultural Inclusion and Diversity Committee, which we go by as CIDC for short. And so CIDC really is dedicated to supporting and addressing the mental health needs of BIPOC and LGBTQ within our 3 cities. Our goal and mission ultimately is to help elevate these voices as an organization, to listen and to better understand their needs, and to ensure that there's high quality, culturally and linguistically services that are accessible to all. So how can we remove these barriers that BIPOC communities are experiencing when they're trying to access care? Our members are diverse. We consist of clients, consumers, families, advocates, and community members who really are committed to the well-being and empowerment of our diverse cities. And what we're doing right now is we have 2 subcommittees that are actually welcoming new members. Our African American Family Wellness Advisory Council, which also goes by AFWAC, and our new committee, Adelante, Hispanic and Latino Wellness Committee. So if you're interested in becoming a member or want to find ways that you can get involved, please contact Jennifer Fang, our CIDC chair, at jfang@tricitymhs.org or 909-326-4648. Next slide. In support of minority mental health and the months ahead, we have compiled a comprehensive list to support BIPOC and LGBTQ communities. We do have more resources available on our website, And this is just an access point for those who are looking for more information about mental health and wellness specific to a community. And again, we are targeting these 5 populations. Next slide. And these are just some additional resources, both state and national, where you can learn more about mental health disparities among minority populations, and how you yourself can help reduce the stigma attached to mental illness. Okay, next slide. Okay, so everyone, thank you so much for joining today's Minority Mental Health webinar. We do encourage you to visit our website to learn more about upcoming wellness webinars and view our past recordings. Like Lisa said, this recording will be available within 24 to 48 hours. If you'd like to request and schedule a specific webinar for your community or organization, you can contact us at cmht@tricitymhs.org. Also available on our website, we do offer weekly community connections, which is open to all to attend. It's a virtual space for community members to really come together and have an open conversation about mental health, stress, coping during the COVID-19 pandemic. And so this works in conjunction with our wellness webinar series each week. So please visit our website to learn more. And at this time, do we have any questions in the Q&A?
No, I don't see any questions at this time. In the box, we are just at 1 minute before 12, so we ended just on time. Just want to thank Jennifer and Hannah for joining me today on this webinar, and for everyone who logged in to participate. If you do have a last minute question, please use the Q&A box. Otherwise, we appreciate your time. And if you can please complete the survey that is sent out after this, and provide your comments and feedback. And just know that you can visit our website, as Hannah mentioned, to view future and upcoming webinars that we'll have over the next month or so. And with that being said, someone just snuck in a question. Well, it was a comment. Thank you very much. Great job. So good job, Jennifer and Hannah, for today's presentation. All right. Well, thank you so much. And have a great rest of your day, and stay safe out there.